Hello, hello.
Hello, good morning, Jeff
Yes.
and Mark and TEA.
Hello, TEA. Mark, are you there? Can you speak?
Unmute.
Can you hear me?
Yeah,
Yes, we can. Very good.
you're just unmute. All right, well, Mark, thanks for doing that.
Yeah, thank you so much.
Yeah.
Yeah, I'll do what I can for you guys.
Damon, are you there?
I'm sorry, can you guys hear me?
Yes, sir.
Yeah, we can.
Okay, perfect.
Hey, Damon, good morning, sir. Sorry for the last minute. This is Jim Bailey. I'm the president of Achieve. I had planned on taking the first few slides of the deck and then flipping it over to Jeff Williams to talk about reporting, but I have picked up a wicked stomach bug. So I've asked Mark Christensen, who's our national sales director, to take those first few slides, if that's okay.
No problem. I've made them both co-hosts, so they'll be able to share those slides.
Awesome. Thank you very much. Appreciate it. And
problem.
again, sorry for the last minute change.
No worries. Thank you.
I'm going to go on mute.
Okay, can everyone see the first slide?
Yeah, yes, sir. We can see it, and we'll get started in about 6 minutes.
No problem.
To allow some folks to come in, but yes, we can see your screen.
No problem. Just making sure it all works.
Thanks for adding Mark, Jeff. Appreciate you doing that.
Yeah, no problem.
I don't think I had his name on that cover.
No, we're all Gumby. We're all flexible.
If nothing else, right?
It's the one thing we got going for us.
I see that Diane has joined us. Good morning, Diane.
Good morning.
Hello, hello.
Okay, well, it is 9 o'clock and we want to be respectful and timely. So good morning to everyone. Welcome to the Achieve Health Management webinar, vendor webinar for school year 2022-2023. We're excited that you all could join us. So thank you so much for taking the time to be here today to find out what Achieve Health Management will be offering as we go into next school year. My name is Damon Hoyle. I am one of the representatives here at TEA that manages the Reopening Schools Grant, which is the grant that is the overarching grant of the K-12 COVID-19 testing program. And I am joined by some of my colleagues from the Texas State Health Department, also known as DISHES. And so they're here to join us, and we collaborate. As you all know, TA collaborates with DISHES to help support public and private school systems with the K-12 COVID-19 testing program. And so we're happy to be here today with Achieve Health Management. I'm going to turn it over to them in just a second. I want to go over two other quick things. This webinar is being recorded, so please know that it'll be posted at the end of the week so that you all can review it, or for anyone that has missed the webinar, they can view it. And we're also going to post a link to the PowerPoint presentation or to the slide deck that they shared today. Also, we will have a Q&A session segment at the end of today's presentation. So please feel free to use the Q&A feature to type in your questions, or you can put them in the chat feature as we go throughout. We're going to make sure that we try to get to all your questions. And if we can't get to them, we will follow up with you individually. So with that said, I'm going to now turn over the mic to our representatives from Achieve Health. Welcome.
Good
Thank you,
morning.
Damon.
You're welcome.
All right, well, good morning, everyone. We are Achieve Health Management. My name is Mark Christensen. I'm the National Sales Director. I'm going to go ahead and start this thing off. So Jeff, if you don't mind going to the next slide. So to start off, really, we just wanted to say a big thank you to all the different school districts and private schools throughout Texas. We were thrilled to have the opportunity to provide support to all the schools in this 2021-2022 school year. To date, so far, that school year, we have provided support to over 700 school districts and private schools. Again, we are honored to do that, and we certainly look forward to supporting all of you in this upcoming school year for COVID testing. So looking at this new school year and what we're going to be offering in this new school year, we still have the same products and services as we offered in this previous school year. So that is going to be starting off with our PCR test, the Gene Finder. We will still be offering this for the same price. This, of course, is supported by our network of Clia laboratories to help process those specimens. Outside of that, we also will still be providing our rapid antigen tests, which we've been using the GenBody, and those are still at the same price as well. And then our third offering, which we will still be providing, is our testing services. And what is included in that is we can provide the clinical staff to help you with administering tests and operating those testing sites. We are also able to help support you with coordination and management of various different testing schedules and testing sites, depending on how many locations you want to conduct testing at throughout your district or campus. We will also be providing the HIPAA-compliant online portal for registration, consent, results tracking, notification of results. So we'll still be providing that as well. And as I just mentioned, we do have the laboratory network that is able to provide the turnaround time of those PCR tests in 24 to 48 hours. Lastly, if you're going to be using our testing services, we will be providing the PPE, the administrative equipment, all the shipping materials, the boxes, the shipping labels, everything necessary there to manage that testing site. Okay, so now as we move into this new school year, as we get closer to the start of the fall semester, there's just a few things to keep in mind and consider. So right now we do have a team that is available to conduct kickoff meetings. So if you have any interest in utilizing Achieve Health for testing, COVID testing this fall, please reach out to us. We'd be happy to get on a phone call with you to discuss what you're looking to do as far as testing in this school year. Whether you need staffing or not, what your expected volume of testing is. And we are happy to provide any recommendations around testing schedules, number of sites to be testing at, and all of that. So please reach out to us. We'll provide that support. Really outside of that, as far as what the school district will be responsible for is just providing the space, whether that be the gymnasium, the nurse's office, a classroom, or a section of the parking lot for a drive-through testing. We just need the space, maybe some tables and chairs, and then outside of that, the Achieve team can handle everything else. We will be providing the tests, the specimen collection kits, the PPE, shipping labels, the portal for, again, registration, consent, everything there. And again, we can handle everything else moving forward from that point. So really it's just scheduling the kickoff meeting, and we can just go into detail there as far as what you are looking for and what we can do to help support you in this school year. Now, as far as our testing processes for PCR and rapid antigen, there is some customization there, whether you need our staff or not. So if you are a school that has your own clinical staff, your own school nurses that can handle all of the testing, all of your testing needs, we can just provide you with the PCR specimen collection kits, the shipping materials or the rapid antigen test kits, and your staff can do that yourself. If not, if you need our support, we of course can provide the clinicians on site to, again, administer those tests and manage and operate that testing site. Also, if you do not have the space indoors inside one of your buildings on campus, we are able to set up drive-through testing sites as needed. And one update for this school year is that Clia waivers will be required for rapid antigen testing. So if you do not have that yet, if you have any questions on that, or you need help with filling out the form and going through that process, please reach out to us. We are more than happy to help you as you go through that process. Okay, I believe that is the last one there. So I'll go ahead and hand it over to Jeff Williams to discuss updates and reporting.
Thank you, Mark, and good morning again, everyone. I see a lot of familiar faces on the call today, or a lot of familiar names. I don't see a lot of faces. So thank you all for joining. I think what Mark highlighted was something that we thought a lot about. We didn't want to introduce a lot of change for the upcoming school year. What we know, with every year and every change, it feels like you have to come in and learn a new process, learn a new system, learn a new test. And so what you're going to find is with the PCR program and the rapid testing, they remain largely unchanged. So those rapid tests you're familiar with, you'll be able to continue with those. The PCR program, which we believe provides a more accurate diagnosis of people being tested, is still a great program that you can either self-administer or that we can come in and do for you. The one change that we did want to make sure that we discussed today was for rapid test reporting. And so we know in the previous school year, rapid test reporting, it went through quite an evolution, from October to now, where there was kind of a heavy manual reporting element involved. And we began to integrate some other options, whether it be an online reporting tool or a web form where you're just able to provide kind of a summary count of tests being used. We know with all that change, it made it difficult, or at least it made the reporting processes inconsistent. And so we are going to start the school year with a new reporting platform, but it will be the platform for the whole school year. And we looked long and hard to make sure that we had a reporting platform that was going to be easy for everyone to use and provide some features and usability that we know was asked for quite a bit in the last school year. So Simple Report is going to be the reporting platform for rapid antigen testing. It's actually a product developed by the CDC, so it kind of has that CDC stamp of approval, which is great. It's actually connected to Texas DSHS so that individual results are automatically fed to the state. It makes a lot of that reporting process easier. We know there's still some local health department reporting that everyone will need to do. Probably some additional TEA reporting for positive results that schools will need to do. But the great thing about Simple Report is it is one platform that's going to be able to provide that individualized reporting to the state. And it will also allow us to help manage the count of tests being used. So you don't have to send us those additional weekly reports summarizing how many tests were administered at each site, how many were positive, how many were invalid or excluded. This one application will really help do it all. So we think it's an easier reporting process. We like the visibility that it gives you all as test administrators, and can also provide to staff or parents and guardians of those being tested. And we do believe that this one site does handle a lot of the testing needs that you've all brought up throughout the last school year. I wanted to provide just a snapshot of what the actual test administration page looks like. Again, very simple process where you're able to look up a person in the system. If they're not in the system, that there's a way to enter them into the system, and we can talk a little bit more about that either on this call or ideally on some future webinars that we'll be able to schedule for all the schools throughout the summer and into the fall. But again, very user-friendly system once we get the patient information into the system. So there's some options for inputting student and staff data into the system. And again, it's one of those features where it can kind of be customized or tailored to the approach that you prefer for your school or your district. There is an option to upload data so that you have all the information right at your fingertips in the system, kind of like you would do with an attendance record or a report card maker, where you have to upload all that data up front so that everyone has access to the names and information in the system. So there is an option to do that. I know a lot of the bigger schools really appreciated that functionality in our previous system. If you don't want to go that route, it's fine. There's also a pre-registration link and QR code that we can provide, where people being tested can be provided with a link so that they can just enter their information on a case-by-case basis, and they can get it entered before testing is conducted, so that you and your test administrators don't have to do all that manual entry if they don't want to. But then there is also the ability to just have test administrators manually enter staff and student data into the system on a test-by-test basis as well. So again, kind of based on how you like to run your data, there are ways that the system can be built to conform to that. One of the other most frequent questions we got last year was, how do we provide a nice professional looking test result message to those being tested? And so I know we were missing that last year. Simple Report has a great feature where you can choose to have your test result as an individual being tested. You can choose to have your test result texted and or emailed to yourself, so that you can maintain a copy of that and provide that in other places where needed. So again, it was a very common feature that a lot of people asked for. We want to make sure that this new system had that as well. So this last screenshot I'll provide is just what the final test result or test reporting page looks like. It provides the basic data that you would need to kind of get a snapshot of what's happening in your district or your school. And since we're able to administer the reporting as a chief health management, we're actually able to go in and grab this data as well, so we can do all of the test count reporting for you. So again, we wanted to find a system that would allow us to handle both sides of the reporting that I know DSHS and the TEA are requesting, that individual results are being reported up to state DSHS properly, but also providing the ability to give the state and the TEA a count of tests used. We'll be able to handle all that for you in this one system. So we think you'll like it. We know with any new system, it can always take some getting used to, but we'll provide some additional webinars and training so that you can get a better look at it. And we're already starting to give some schools access to it, some schools who haven't really mastered reporting up to this point. We're giving some schools access to it, and with very little training, they've been able to go in and really kind of figure it out on their own. And so I think that just kind of goes to the ease and usability of the site. So again, we like it. We think you'll like it too. We're looking forward to being able to give you all a more in-depth look at the system. Lastly, we want to provide some contact information. So for more information about these programs or to get a look at these presentations, you can visit our site, texasschools.achievehealthmanagement.com. We created a custom page just for all of you guys in Texas. To discuss new orders for PCR programs or to discuss new orders for rapid testing, Mark Christensen, who spoke before me, our national sales director, is available. He'd love to talk through your program options and maybe kind of help you plan ahead for the next school year. So his phone number is here and his email is here as well if you want to jot that down, or again, this information will be available on our website following the presentation. Again, I see a lot of schools who've worked with us before, and so if you're just looking to find more information about reporting or about just maybe placing a new order similar to what you've placed before, most of you should be used to our Texas orders email address, txorders@achievehealthmanagement.com. So you can follow up with our customer service team there. With that, Damon, I think the presentation is done. So looking forward to hearing what questions we have.
Okay, great. We do have a couple of questions in the chat feature, and then any panelists, you all can also see what's in the Q&A feature. So I'll start with the chat, and thank you for the presentation so far. First question I see in the chat, it says, does the Clia waiver need to be renewed for this next school year?
Well, it's going to depend on your expiration date. I know that the Clia waivers do have expiration dates, and so I think it's going to depend on when you got your Clia waiver. At least that's my understanding. So double check the expiration date on that, and then confirm it if it's going to expire during this next school year. If it does, then yeah, you'll want to go ahead and get that updated.
All right.
I can't recall. I can't recall how long those are good for. Whether it was 1 year.
It's 2 years. The Clia waivers
Okay.
last for 2 years.
Okay, there you go. Thank you.
Yep. Will we still have Crisis Go?
Crisis Go is still available. I saw that question, Renee. It is still available, and the schools who are very integrated with it, by all means, we're not getting rid of Crisis Go. We just know there were some problems with the data. Being reported as a whole or as a sum correctly. And so we wanted to make sure we had a system in place to help those schools who hadn't done a full integration. But yeah, Renee, and I know there's some other schools who had a similar question, but we can definitely ensure that the Crisis Go is still available. We're not trying to make your life any harder. So let us know if you'd like to continue with them.
And since someone wants to know about the transition, so is the transition happening right away in August? How is it transitioning happening from the one reporting system to the new one?
Yeah, good question. Continue doing what you're doing by all means. But this summer, we're going to try to begin moving schools over to the new system prior to the start of the next school year, so that it's not like you're getting flooded with a bunch of requests late in August or early September. So yeah, we're actually in the process right now of reaching out to schools individually to let you all know about the simple report transition. If you see an email about that, certainly reply to that email. But yeah, we're going to start pre-registering all the schools in the system, and we'll reach out to you to ensure that we capture all the right locations, and most or as importantly, that we also have all the users who you would want to have access to your district or specific locations in your district.
The next question, will we be able to open testing utilizing your staff starting August 1 of 2022?
Yes, that's my understanding.
Yep. Yes, that is, and Diane, I don't know if you want to jump in there too about the staffing piece. But yes, everything right now, we'll be announcing TA dishes. We'll be announcing all of the dates in about the next 1 to 2 weeks before July 1. So you all will get the more specific dates in terms of the application launch, when you can start ordering tests, and then when staffing will be available back on your campuses. If I have unused rapid tests that expire, will I be able to return and have those replaced? I have several boxes that expire in October.
Damon, I'm not sure this is a better question for the TEA. I'm not sure about the expired test process.
So I'll say this, and then Diane or anyone else, feel free to jump in. So if you have tests that don't expire until October, we would say to use those tests because they still will be good for the rest of the summer, August and September. And then we would then go from there in terms of you ordering more tests so that there would not be a lapse. But in terms of turning those in to replace those now, right now, that's not the process that we have set up. Diane, did you want to add anything to that?
Certainly. Thank you so much, Damon. Yes, by all means, use them all the way up until the expiration date. If you do have some on hand that expire, then you would submit a report in the test and services received reporting process area, same place where you say, I received product from this vendor, or reporting the staff hours. You would report the number of expired tests. And we do not have a return policy. So if you need new product, then you'll have to order new product. But you don't write them as expired until they expire.
Got it. Okay. The next piece, this is in the chat, and continue, please, folks, to continue to drop your questions in the Q&A feature. But the other question says, I don't think private schools were required to have a Clia waiver. If that's the case, do we need to get one?
So this is Diane. I can answer that also. So last year, or 21-22 school year, Achieve Health Management held the Clia waiver for schools for rapid antigen tests. And for the 22-23 school year, that's going to change, and the schools will be required to obtain their own Clia waiver. Now, I'm not talking about a Clia that's required for PCR testing, because that's done at the lab. We're talking about the waiver that is required for rapid antigen tests. And schools will have to sign up for their own Clia waiver this year, and it is good for 2 years. And again, Diana also asked a question about that in the chat, and she says, if we used your staff, you had a Clia waiver. That is correct. The Clia waiver was taken care of by Achieve last year, but it won't be for the 22-23 school year. Again, for rapid antigen specimen collections.
Thanks, Diana. And I see that question from Amber, just a little more about the Clia waiver. The TEA provides some information about applying for the Clia waiver. Not a complicated process, but we can email that information over to everyone as well after the call here, just with the links that provide kind of a how-to, and then the actual link for the application itself.
Yes, and it is a very simple thing. As soon as they hit submit, they get their Clia number. So, and there is a charge. It's about $180. I'm not sure of the exact price, but that's what it was last year.
Yep, it was $180 last year. I'm going to share my screen real quick, just to kind of, someone was asking about the Clia waiver, and I wanted to show you where to go to find that information. So I'm going to share my screen really quickly. Let me pull that up. Okay. So hopefully this works. Can you all see my screen?
Yeah, thank you, Dan.
No problem. So this is the TA COVID-19 support website. Once you get there, you can click on K-12 COVID-19 testing project. And if you go down to under FAQ and guidance, you click on the FAQ guidance document. And then I'm just going to do a quick search, Control F, Clia. And it gives you everything you need on page 14 about the Clia waiver. What is it? Where do I apply? The application link is there. It takes you to the Clia waiver application link. And then it provides you some other information there. So all of that information is available for you under the FAQ right there. And I also want to say there's some other information on our website as well about the Clia. So here it is as well. If you look right under, you can go to the FAQ and you look right under applications, Clia waiver applications, quick start link. There's also the application itself. And then we give you an exemplar, an example of how to fill it out. So it's all there for you right there under applications and within the FAQ. If you have some more specific questions, we've tried to answer those at the top in the FAQ. Okay, so I will drop this link in the chat. I'm going to stop sharing and then we can go to some more questions. Next question. Do we know if there will be another school support grant like last year it helped cover? So there will be the school health support grant, which is under the Reopening Schools grant. And there's two parts. When one of them is direct funds to schools to help with other services outside of testing or other allowable costs. That will be extended. More information will be coming out about that. And as of right now, the Clia waiver is still considered an allowable cost. So yes, it can still be covered under that grant as of now. We'll be sending out more information on all of that very soon. So thank you for that question. And I did drop the link to what I just showed you all. And so you can find out all of the Clia information that you need in the link that I just dropped in the chat.
Damon, I see that. Yeah, sorry, I see that question from Lori about consents. I know it was a common question at the beginning of the last school year. Our understanding is that the schools have consent to test, and this was in relation to the new reporting system. So our understanding is the schools are getting consent to test. They're not getting consent to test only in one reporting system. Now, I don't know if the TEA or DSHS has a stance on an expiration for those consents. So I'm curious if you have a thought there.
Okay. I want to can you repeat that one more time for me, Jeff? I want to make sure.
Yeah. Sorry. Yeah. Let me not make it so wordy. The consents obtained for students and staff last year for testing, will those still apply for the current school year, or does the TEA believe that they need to obtain new consents for a new school year?
Great question. Typically, and I'll go back to the team to clarify to make sure we're all aligned. But typically, you get consents annually, just because things change, school years change, and so those consents typically last for a calendar school year, if you will. So most likely they'll have to be new consents. But what we'll do is we'll make that clear in our guidance that we release in the next 2 to 4 weeks. So I'll make sure that that's clear in the guidance.
And this is Diane. That's a great point, Damon. The other thing that I would suggest that the schools look at is the actual consent that they have asked parents to sign, because it may say, I don't know, I consent to have my child tested in the fall of 22 or 21. Then you would need a new consent. Or I consent to have my child tested before they go on this field trip, and the date is specified, then they would need to get a new consent. So the schools need to go back and read their consent that the parents are signing and then make that determination. And if it does specifically say a date or a time, then it can be changed to say, I consent to have my child tested during the 22-23 school year type of thing.
Yeah. And so what we'll do is we'll put everything in our guidance to make sure that, hey, go back, check what you have parents sign, ensure that it's in compliance and in accordance with your school system, private or public. But bottom line is, before anyone is tested, there needs to be an active consent on file for that student to be tested for that particular school year. Now, whether it lasts 2 years or a year or a semester, that might differ, but before you can test them, it needs to be active, or current rather. Can we get a generic consent like we did when we initially started? If we have to do an update, TA provided the consent to us first year, and then the chief provided us the consent for testing. So Chief, will you all be providing another a consent template again?
Yeah, we certainly can. It was very much like the TEA version. So yeah, we can definitely send that out again to make sure everyone has it.
Got it. Great. Please continue to ask your questions. You can, like I said, use the Q&A feature or the chat.
While we're waiting for other questions, I just wanted to say again, what we will plan for some reporting system webinars for this summer. And again, it's our goal to get schools set up ahead of the school year. So it's not part of that beginning of school year rush of everything else going on. So I know many attendees may be off a little bit this summer, which I would greatly encourage, but do keep tabs on your email for more information about that.
And this is Diane. Jeff, could you please just review? I know that you had said that your prices didn't change for you or Mark for rapid antigen and PCR, but could you identify what those prices are and what you did change for this year, for the 22-23 school year?
Yeah, absolutely. I know when Mark was talking about the PCR program itself, he did mention the pricing hadn't changed. The PCR test kits remain $80 per test kit. We are charging for staffing. So any staffing used for rapid testing or PCR testing for this coming school year, that will also be billed at $80 per hour per staff member with a 4-hour minimum. In addition to that, we have rapid testing, which remains at $10.50 per test. And the minimum order for rapid tests for the gen body tests are 25 tests because they come 25 tests per box.
And so by you changing your prices for staffing for collection of either specimen for rapid antigen or PCR, that's going to make it easier for the schools so that they don't have to, because we had some back and forth with the schools that, well, if they collected PCR specimens, then you shouldn't report the hours. So that's going away, and all staff, all Achieve staff that's on the campuses will be reported just regular way.
That's right. Yeah, thanks for adding that, Diane.
Thank you.
There's another question. Will the data student and staff transfer from crisis go to simple report?
No, the results data won't transfer. So we'll still have that data in a 2021, 2022 database for reporting. Lori, if you're referring more to maybe just basic staff and student data, demographic data, first name, last name, date of birth, stuff like that, it won't automatically transfer, but we can work with each school on a case-by-case basis to make sure that the data that they want preloaded into the system can be preloaded, which just makes test administration so much easier for the person conducting the test. So we can connect, Lori, and just see if there's some, if you would prefer to have any of that data preloaded, and we can certainly do that for you. Yeah, let's discuss, Lori, and we can get a file so that we can get that all updated for you. Yeah, thank you.
There's a new question in the Q&A feature. Are both testing consents of PCR and rapid testing on the same form, or does this require a separate consent? I believe it's the same. I believe what everyone has received is the same consent, but correct me if I'm wrong, Chief, do you all have two separate ones?
No, yeah, but my understanding it's all the same. I'll double check. We haven't thought about the consent since last fall, so I will double check to make sure. But yeah, I'm on the same page with you, David.
Got it.
And if I could just add something else in, to that question, to that answer rather, just make sure that your consent says that I consent to have my child tested by either means, by PCR or by rapid antigen. They're both collected the same way, just right at the inside of the nose. They don't go all the way up to the brain, like some of them used to. So just to put on that consent, that the child may be tested for either test.
Makes sense. Yes, we'll double check.
Great. Thank you for that clarification, Diane. So one other thing I'm going to share, I know Diane mentioned the vendor resource sheet, and I want to make sure that everyone knows where to locate that. The link, and continue to drop your questions in the chat, in the Q&A feature of the chat. But in the link that I included in the chat earlier, and I'll drop it again and then reshare my screen. I want you all to see, there's the link there. I'm going to share my screen again. So when you click on that link, it will take you here. You all can see my screen?
Yes.
Yes.
Yeah, thanks, Jim.
So when you go there, it takes you to K-12 COVID-19 testing project. If you go below lists, then you're going to see school year 2021-2022 vendor resource sheet, but then you will also then right below it see 2022-2023 vendor resource sheet. So they're both there. The second one, 2022-2023, that doesn't begin until the fall. So it wouldn't be active until August 1. But we went on ahead and put it up there because the application will launch prior to this. We know that you all are planning. And so we wanted to give you all some time to review the vendor resource sheet before the actual new program launches so that you can plan accordingly. And as anything is updated or as it changes, we'll update the link and then the date will change. And so you'll know when the most current one was posted. So this one was posted the 13th. And if it's updated again, you will know that it was updated because the date will change. So that's where you can find that information right there.
And a new one will be posted probably this Friday or Monday. So be on the lookout for that.
Yep.
And the difference that I did for this vendor resource chart that Damon was just talking about, because this is for the 22-23 school year, down at the bottom, there's a synopsis of the things that changed for each of the vendors. So that's an easy way for you to identify what has changed.
Diana, you in the comments you'd asked about access to the old data. Yeah, that data is definitely not going anywhere. We're not shutting the system off. We do believe there's a better system going forward, and so we're looking forward to doing a better demonstration of that. But you'll still have access to everything you've done for this last school year.
And if you check the chat, I went on ahead for everyone's convenience and I put a link to the new vendor resource sheet in the chat for you so that you can go ahead and check it out.
It looks like we might be about to wrap up. So I just wanted to put the contact information up one more time. Again, you can view this presentation and find some other reference information on our website, texasschools.achievhealthmanagement.com. There you can find the contact information for Mark or for our customer service email. So all that information is still there. If you guys have any other questions after the call, I know we've worked with a lot of you before, so hopefully you know how to reach out to us, and Mark or myself will be able to get back to you just as soon as possible. And be on the lookout for more information about Simple Report. And then, any specific requests that you have about reporting, certainly let us know, and we'll do our best to try to make this an easy transition, or at least an easy reporting year for everyone.
Thank you for that, Jeff. There's one more question for Achieve. And continue to drop your questions. We still have 20 more minutes allocated for this. We don't have to stay the whole time, but we do have a full hour allocated for this, or set aside for this. Do you see the question, Jeff?
Yeah, the question about MyFIs?
Yeah.
Yeah, so that's one of those, it is possible, and it will largely depend on testing volume. I believe, Diana, you come from a pretty large district, and I think you guys are inundated with testing needs. So it's certainly something we can discuss. That's one of those things that we would need to discuss in one of those joint kickoff meetings for PCR testing. So let's talk about it. Reach out to us, and Mark and our team will be sure to get back to you and kind of just discuss what a testing plan looks like for you all going into the next school year. And we'll definitely make sure that you have all the right equipment to meet your needs. Hopefully that's not too vague an answer, but it kind of depends on the testing needs. Let's discuss and see what we can do for you.
Okay. Well, I'll give it another minute or so to see if there's any more questions, and then if not, we'll go ahead and wrap and conclude the meeting, but want to make just a little bit more space for any more questions that might arise. Okay, well, I haven't seen any more. Thank you all. Thank you, Achieve Health, for all that you're doing to partner with TEA and DISHES to support public and private schools with COVID testing. We really do appreciate it because we know that it's making an impact in school communities across the state. Thank you for every attendee, for all you all are doing, and we hope that you're enjoying your summer, and we're looking forward to continuing to support you all as we go into next school year. So thank you for joining us. The recording will be posted in the slide deck. If not by tomorrow, close of business by Monday. Everyone have a great rest of your day, and we will be in touch soon.
Thank you all.
Thank you.
Thank you. Bye.
Thank you.